Hello, everyone, and welcome to this session 4 of 5 of the COVIDSafe Legal Compliance Plan workshop series that we are running. My name is Nihal Samara. I'm the General Counsel and Legal Director of the law firm Kaizen Synergy, and I'd like to welcome you all to today's session. Today's session really looks at building upon our previous works and sessions which covered how to set up your legal compliance plan, what are some of the activities and works that staff and personnel need to do within your agency. We also covered off specific items around areas such as COVIDSafe forms as well too, and also what goes into your legal compliance plan itself. We will really be building on this today to look at what are the key reporting requirements that you need to do and how this can be monitored within your agency. This is to ensure that services and staff are safe and effective and accessible and acceptable for your company moving forwards. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar and recorded, we do pay our respects to the traditional owners accordingly. So today's session, as I mentioned, is going to really look at the reporting and monitoring of management activities for your COVIDSafe plan. We're actually going to look at what some other agencies have done to really give you a hands-on work around what has actually worked well for agencies. And some of these agencies have equally been in Victoria, where there has been incredibly stringent lockdown measures and continues to be extremely stringent lockdown measures as well too. And how can we start to put these things together? How can you also document and load information up against your COVIDSafe plan as well too? And we know that some agencies have actually had to submit their COVIDSafe plans to health departments already to show that, well, what are the systems and processes that they've actually got in place to manage this as well too. So these works that I'll show you actually applies to a broad range of services. It's not specifically focused on health and community-based services. But when I say that, the net is cast wide for not-for-profit agencies. So whether you provide events, religious groups as well too, we've had a lot of religious groups attending these sessions as well too, of all different, just about every different faith as well too, outreach services as well too. So what I'm actually showing you today is used by a number of agencies, but we will be focusing on a couple of case studies from 2 or 3 different agencies as we go through this as well. So when we look at reporting, monitoring, and surveillance, what you'll find is that it comes back to looking at, obviously, your COVIDSafe plan. It looks at policies, plus also your pandemic forms, and together this looks at the monitoring for your agency as well. We will be looking at how this works, how we can start to join the dots together just to make it easy as possible without having literally your business turn into a compliance-based COVIDSafe, and that's all that you effectively do. Well, there is a fine balance between looking at the safety of staff and clients to make sure that you can do this in just a really simple and effective way and meet your legal compliance obligations, but also making sure that it doesn't become this all-encompassing and consuming task as well too for your agency. So really, by attending this webinar, what we should be really seeing from this is you should get your timely set of resources, and we'll be sending all the materials out to you today, and also looking at what your COVIDSafe systems are and activities that other companies have actually used that have been working well, and looking at how they've actually managed to grow their services during this time. And also see some case examples of what has worked and what really continues to work as well too. And this is going to be a really hands-on session. With it, a few housekeeping items just before we jump in. This webinar is being recorded all the way up to the question and answer session. You can ask questions as we go along in the chat group as well too. The webinar will be published and made available on the Gemba 360 YouTube channel, along with all the other information that we've run over the past number of months now. And there is also a knowledge base that is also available, which includes the weekly circulars and also questions that have been raised by attendees. And you can actually get to that by simply going to the Kaizen Synergy website. And I'll just bring that up here. You'll see my picture listed here as well too. But by going to kaizensynergy.com, you'll find that we do have the knowledge base information, which is also shortcuts to all the question and answers that people have raised in the previous sessions, and also copies of the past webinar that you can also go in and have a look at as well too. So that said, if you do have any questions, by all means, push those into the question and answer pane, and we will address those as well. A couple of case examples that we will be using. I would like to thank Laurie Seville, the Chief Operating Officer at Rumbalara Aboriginal Corporation, who has agreed to show through some of the dashboards that we will be referring to today, and where some of the key reporting features are that we will actually look at monitoring and what that agency has done. So when we look at, and I'll just refresh some of these parts for you in terms of moving and looking at the monitoring and reporting of your COVIDSafe plan. So when we look at monitoring and reporting, one of the things that we come back to is the directives coming from the Commonwealth. And this was something that was published some time ago. And with this, what we see is essentially a number of key Commonwealth directions. These include employers should have policies, procedures, and technology to support employees to work from home where possible. Employees are supported to work from home if possible around this. There should be measures for social distancing, trying to ensure 4 square meters per person, discouraging carpooling, promoting good hand hygiene, and also a number of other items, again, all of which we have covered in the previous sessions. This also includes looking at training staff on hand respiratory hygiene, and also ensuring that employees adhere to official advice about how to help reduce the spread of COVID-19. Now, when we look at some of the state plans, and I'll focus on use Victoria as an example around this, Victoria's state COVIDSafe plan that was actually released by the department in some of the measures did cover some of these, but it was a lot more generic in what was actually expected. So with it, we've actually come back to this, and the measures that we're going to look at is how do we actually measure what has gone on here? How do we monitor what has been done by staff? For example, how do we ensure that we educate staff about the early signs and symptoms of COVID-19, looking at point 12, and the need to stay home if unwell? What is the actual activity? What is the actual measure and monitoring that we need in our agency to meet this specific requirement? In terms of also undertaking frequent cleaning and disinfection of workplaces, and I'll just jump to number 7 at the top of this slide. Well, what is the monitoring and reporting that you have to meet that requirement as well? So we're actually going to drill down into actually looking at how you can do this. And also what I want to see is what are the documents that you can actually load back in to say that you've actually done this. So what is the evidence that you need, and where do you actually put this in order to save it as well too? And we'll be going through that as well. Now, in terms of how this can be measured, and when we've looked at this over the past few months with agencies, and the first thing that people turn around to us and say is, oh, look, why are we even talking of clinical governance and frameworks, and why are we even talking about this? We're not a health service, and why do we need this? So first of all, this slide is just a directional slide that we're using, and I'll just spend a couple of minutes around this to say what our thinkings have been. So from a legal compliance point of view, it's easy to say, right, here is the legislation that you need to meet. Here is what needs to be done. But what really need to see is, well, how do I actually measure this to ensure that my agency is safe and delivering effective services? What the Health and Community Services and National Quality Standards framework talks about is clinical governance. It talks about risk, it talks about complaints, it talks about service staff and what their experiences are, it talks about training and processes. It actually gives us a framework and a lens to look through our COVID-19. And when we apply this over the top, you'll see that we've got compliance standards in the middle, around it. We've then got risk, we've then got compliance, and we've got the audit process. And part of this is to ensure that your systems are there around making sure that the clinical governance frameworks that hospitals and health services use, believe it or not, going back a number of years, actually looks at how services are delivered that are safe, effective, accessible, acceptable, appropriate, and efficient. Now, those very measures is something that we all need to look at in terms of our COVIDSafe plan. How do we know that our services are safe? How do we know that our services are effective? It's all warm and fuzzy language that is being used and a lot of the indicators that are coming out of that. But what we really want to make sure is how safe, effective, accessible, acceptable our services are. So we have actually adopted a clinical governance framework around this when we start to look at the activities and monitoring. Now, I have used this slide in the past around when we've looked at this. What we're going to look at today is the disaster or the COVIDSafe plan and how to monitor and report on these activities. We're going to look at the policies and how to update these within your agency. We're going to look at the monitoring of the HR registers, and we're going to look at also at the end the risk registers for incidents as well. Now, part of this that we're working through is that this works for any size or shape agency as well. Rumballara has about 250 staff or thereabouts. And again, they've rolled this out and run this over the last number of months now. They've put in some 10,000 entries in terms of their COVIDSafe reporting forms, loaded some 6,000 documents in. Equally, we've also got a lot of smaller agencies that are doing the same thing as well too. What we're able to actually do from this, and actually the end point around this, is the monitoring and surveillance for ensuring your services and staff are kept safe, services are effective and accessible, and all the indicators I just spoke about before. So we know that really what we're talking about actually works really well. Equally, there are a couple of other agencies which I will equally acknowledge. One being Women's Housing Limited, and the other being the Southern Migrant Resource Centre both in Victoria. And they've had to submit and be called upon to submit their DHHS COVIDSafe reports and their COVIDSafe plans. Both of those agencies have submitted their plans. Both of those agencies haven't received any variations to those plans based on the works, exactly the same thing that Rumballara has also been done. It's also acknowledged from other departments as well too, and we've heard this from some of the executive managers at Rumballara to their credit equally, that there has been certainly commendations going back in terms of their COVIDSafe activities and plans. And these are agencies that work within vulnerable groups of the community. Rumballara obviously being an Aboriginal cooperative and obviously has an aged care service. Women's Housing, equally to their recognition and credit as well too, provides housing and transitional services both to women and men as well too, and also provides a broad range of other support services. So you can see across network of different agencies following these same protocols and systems and being able to report very, very quickly back to the departments without any problems whatsoever. But in doing that, are keeping their staff safe and services being delivered. So when we start to look at the monitoring of these plans, the plan is just one part of it. Effectively, what we need to do to ensure that services are kept safe, and this was from our previous session, is to look at the things like the daily COVID daily assessment forms and also other policies and procedures as well. So let's actually have a look at your dashboard and jump into that now. So when we jump in to your dashboard, and let me bring this up, and I'll just slide this across. Your dashboard essentially has the COVIDSafe assessment forms running along the left-hand side that you can see here. We'll have a look at the disaster system, the HR, and also the risk and gender docs today. So when we look at the Commonwealth criteria around this, the first thing that they wanted to see was where and how do you actually monitor your COVIDSafe plan activities. And what we need to essentially see from this, and let me bring this up for you, is your disaster side of the system and how you actually monitor your COVIDSafe plan. So essentially I got here by simply clicking on the disaster module. It opens up, just to go back to this section here. I can see since last week, some 2,000 odd agencies have jumped in and updated their plans, or a couple of thousand odd agencies at the very least in the last week alone. So with it, you can update your profile simply by going in, and let's say I'll start by actually updating this, and I'll just say my agency name. And if I save that, what will come back is that this will be updated automatically, as you can see here. And then I can go into the projects. Now let's actually have a look at what happens. This will automatically change the name that I see here to your company name for this middle column. And one of the things that we need to look at is monitoring of the COVIDSafe plan. So the COVIDSafe plan, to pick it up, essentially goes back and covers all of your specific legal compliance obligations. And we have done this around, if you remember, and I'll just jump back to this three-step framework that we introduced and showed you how this works. We've divided it up, step 1, step 2, step 3. We've included all of the specific legal compliance obligations. So you've got your legislation. We'll go through some of the checklists from work health and safety, fair work and the likes, plus also your state or territory COVIDSafe plan as well too. And that's all been fed into your dashboard that you can see in front of you. Now, when we look at this, and if I just jump back to this here, effectively I've got my list of items that we can actually go through. And let me just pick up one of these. So in terms of what I'm going to look at, the first one that I want to see is my own policy requirement as well. And this effectively says, check the policy templates that I need to action. And so with it, what we can do is, first of all, when we monitor this, what I want to actually look at is who is this actually assigned to, and complete this here. So in this case, I'm going to go to the menu, I'm going to select the assigned it to, and I'm going to give myself till the end of this month to effectively do it, and I can complete that. The milestone that I'm going to measure against is the COVIDSafe plan, and with it, I can essentially save that. Now, once I've done that, what you'll find is that it automatically updates this. Now, for me, what I want to do now is effectively do a couple of things from this. The first one is to actually go in and make some comments around this. So what I'm going to do is to say, I have spoken to the CEO, and now taking the date to review my policy. And from here, I am going to send it out to staff. Okay, so that allows you to effectively run up and keep a file note within your COVIDSafe plan space. This gives you more than just an Excel spreadsheet to actually run this off. So it gives you the date, it gives you the time that you've actually done it, it says who you've spoken with, and it basically gives you a file note of your COVIDSafe activity. And you can use this. Now, if you have more than one staff member accessing this, then their names will equally come up. I'm just logged in as my Fred Flintstone character, and I can update this plan and provide the items around it. Now, if I look at this, this will actually prompt me to say, right, I need to actually have a look at my policy template. Now, I want to actually now go ahead and look at, well, where is my policies that I need to essentially meet? Where do I actually find these policies? And how can I actually update them directly here? So what I am going to quite simply do is go into my Jumbo Docs, and let me just jump back to my screen and I'll show you how to do this. So essentially we've loaded in a lot of the policy templates for you to use. So from here, the policy templates, if I wanted to have a look at, let's say, the policies, and I'll just do one of these to show you how this works. Here it is here. I'm going to actually have a look at the, let me start with this one, the work health and safety policy. So I can click on download. This will bring up one of the policy templates. You can see I'm just doing this straight live with you. And this is just an example of one that we have on here as well too. I can actually go through and make essentially, and I'll just search and replace this. I can actually go through. This covers obviously all of the specific work health and safety obligations, the core work health and safety obligations that your agency needs to meet. This is already loaded into your Jumbo Docs as well too. And quite simply, if I wanted to actually just replace these for now, what I can quite simply do is go to replace and replace all of these across the board. So I'm just going to make up a community health service. I'll say community ABC D community agency, and I'm quite simply going to replace all. And by doing that, you'll see that it automatically gets replaced. Now from here, quite simply what I am going to do and we are just going to bring this up for you as well too to view. And so what I'm actually going to look at doing now is essentially updating this particular policy back. So what I can do here is go into the work health and safety form. I can actually load this document back in. Now, all I'm going to do is choose the file that I want to load this into, essentially here. I'm going to select the specific policy that I'm going to load in. And from here, I'm actually going to upload it back into the system. The other difference that I am going to make is that I am actually going to change this to actually make it 2021 and also the end date, in this case 2021 as well too, and click on upload. What this will do is do a couple of things for me. Now, the first thing it's going to do is actually update this particular policy. You can see here that if I wanted to actually look at this document, then I can actually go back and actually see all the previous versions that I have actually run. And if I wanted to, I can see the activity logs of who's done what and when. And I can actually have a look at the document details itself. Now, with this, I can also have the latest version, but equally from here, what this shows me is that if I wanted to go in and check my policies, then I can actually run a report to say, well, have I actually updated my policies within my agency? And I can actually see immediately what each of my policies are and where they're actually up to. So with it, what we now need to look at doing before we actually update our disaster report around this and COVID pandemic report is, well, how am I actually going to notify staff that this is going to be done? And what is the process that I have in place to essentially do this? And what we can see essentially is the view of being able to actually look at the reporting that I need to send this out. So what I'm going to do now, quite simply, is post this notice out to all the staff. Now, if I had all my staff in here, I can say, hello, everyone. Here is the new policy. And I need you to read this document that we've just posted in. So I need them to read this new WHS policy on COVID-19. And I need to be able to make sure that people are actually seeing this and actually doing it. Now, I can either upload this document directly from here around this, and let me just bring this up, and I can simply post that notice out. Now, what has happened is this. Essentially, this, you'll see that this notice now appears on the notice board. What it requires me to do is to actually go in and read it. And you can see that I've got the policy listed here. And if I open this up, this will bring up the policy that I was working on. And here it is here around that. And here it is here. And I just won't save that. But more importantly, what it asks me to do is to confirm that I've read it. And by confirming that I've read it, you can see it comes up on the date and the time that it's actually been done. Now, for your company and agency, at the moment, there is literally a swarm of emails, a sea of emails that everyone needs to read and see. And so many people turn around and go, oh, look, I just can't or don't have the time to actually read it. And sometimes they'll say, oh, yeah, I saw it, but I never did it. What this gives you is the audit log. So you know who's read it and when. So if we are measuring ourselves at the moment against the specific Commonwealth guidelines and saying, hey, look, how do I know that staff have actually done this? How can I actually be certain that we've got this in place? Well, you can do it in a couple of ways. Firstly, you've got your documents in the Gemba docs that you can use. You can set these up back for yourselves to actually utilize and update. You can post this out directly to the notice board as well too. You can see who's actually read it. And we've had some agencies that have already been investigated by Safe Work in the past as well too, that do use Gemba. But in saying that, some agencies have actually got the Safe Work Award as well too by utilizing this system in terms of how they're meeting their work health and safety obligations as well. So it's allowing you to join the dots together. Now, that said, when we go back, what we need to look at actually doing is going back into the actual report here and updating it. So in this case, I've now, let's say I've reviewed each of the policies, I've circulated these back out to staff. So quite simply what I can do here is say all policies have been updated, loaded into Gemba Docs and sent out to all staff to read. Great. So I've done that report there, and it's as simple as doing this, and I'm doing this all in real time with yourselves and doing it live as well. Now with it, what I can also do is while this is the due date, I can actually go in and let's say I now want to just actually load a document into this particular file to say, look, I've actually done it. Well, in that case, let me do two things here. The first thing that we can actually do is to say, well, has it actually been done? And what are the activities that we now need to see around it? Well, what we can do firstly is to actually, we've completed our comment around this that you can see here. You can see I've got the status bar that's listed here as well too. And I'm actually just going to mark this as now completed, and I can click on save. So that actually marks and updates my register here. But let's say I now want to actually go in and actually keep a record of the document that I've actually sent through. Well, in this case, I can simply go to the document section. What you'll find is that we've got a list of all of the relevant legal compliance documents that your agency needs to look at. So if I wanted to go back and have a look at, for example, the COVID workplace checklist, I can click on that. And what will come up is the workplace checklist. Here it is here. And if I bring this up, and this is all happening nice and live in live time, here it is here. And we've got that information there as a reference document for you. But now I want to add my own reference document. I actually want to say, hey, I've actually got this policy and this is what I've used. So in this case, all I'm going to do is simply add in COVIDSafe policy, WHS, and what we're going to do is pull off a report to say this is done now published. I'm going to put in today's date. That's great. And this is a copy of the policy document sent out to staff and confirmed they have read it. Okay. Now what I am going to do is also choose the file again here. I've got the WHS policy. It comes up with my file, and I'm simply, just make sure that I do the spell check and click on save with that. And this is all happening in lifetime. So you can see here that now what I've got is the policy document. Here it is here. And I've got it loaded against my register. Now, the reporting of this. Let's go. So with it, let's say, and we've had to do this for some other agencies for the department, various departments of health. So the departments of health have called up and said, right, tell me how your COVID-safe plan is going. What are the ways, 2 steps that we can actually do this to get this done within a couple of minutes? Okay, let's do it in the first section. I want to send off this report. So I'm simply going to go to the export in PDF format. Here it is here. I'm going to click on export to PDF. And I've got my reporting lines right here. And this gives me my details of my report that I want to see, including what's been just completed as well too. And you can see that we've got that listed down the bottom as an example. If we had this done with other activities, then equally that would also be done there. Now, aside from that, what I also want to see is the documents that I've got listed, because it'll reference to some other documents. So I can simply go to documents and click on the same thing. And I've got my list of documents as well too. And with it, this gives me the information that I need. And we've had agencies use this. We've had agencies submit this to the department, and literally their COVID-safe reports are done that quick in terms of what needs to be done. These are the summary reports that you need to see around it. Equally, as we're moving, and if I jump back from projects 1, 2, and 3, I'm just in step 1 around this. If you wanted to print the broader ones out, you can also do that as we go to step 2 and step 3 as well too. But at the moment, we're just sitting comfortably in step 1 in this case here. So with it, the reporting side of this is just really straightforward to actually do. It doesn't matter how many people are actually jumping between your specific COVIDSafe plans. Some agencies have a lot of people, some agencies have 1 or 2 people that do it. As you're collaborating on it and using it even as file notes, you can go through. As I've shown you, it is bigger than just running an Excel spreadsheet or a Word document. By going in, you can actually go through and actually have a look at individual items. You can keep tabs of where things are at. You can see we've listed a whole range of comments and dates and times that things have actually had occurred as well. So from this, it really gives you such a clear way of running your COVID-safe plan, monitoring and reporting. The Gemba docs, you've got your policies in here as well too that allow you to update your specific policy documents, and also all of the templates that you can use as well too. Now, the next part around that I just wanted to really have a look at with yourselves was around the COVID-safe monitoring for staff. And last week, what we did actually look at was specifically the COVID daily assessment forms that you have. And from here, if I click on this, you can see the forms that we've submitted and the likes. Now, one of the key criteria of monitoring is how do you know that your staff are safe? How are they aware of what symptoms that they may have? And are they aware of their COVID-safe reporting obligations? And as the Commonwealth directive says, to stay home if they are sick or have symptoms. Well, this COVID-safe form, if you remember, is located on the left-hand side. You have the checklist tools to actually say whether they meet certain criteria as well too, which is based on some of the clinical governance guidelines and indicators around this. Now, what happens is that as you're actually reporting this as well too, and if I go back and I'll just click on this again, then what you can see here is your individual staff profiles. And as people are completing this, if they're marking it as yes or no around this, then notifications are being sent out to you by email as well. You can actually go in and actually monitor, well, how are they traveling? Do they have any symptoms around this? And this is actually something that other agencies, as I've mentioned, for the likes of Rumbalara, for the Aboriginal Cooperative, Women's Housing Limited is also doing. There are also other migrant resource centres that are also doing this as well too, and are actually actively monitoring their staff when they're completing these forms. They're getting the notifications to come through, and by doing it, as most of them are doing it on a daily basis as well too, it means that they're monitoring of ensuring that staff are kept safe, and equally that any clients that visit or they have to visit are also effectively kept safe from those staff as well too around it. So you can see as we start to jump through this that the monitoring of this is happening at different levels. It's happening at the COVID-safe legal compliance plan. It's also happening at the COVID daily assessment form level as well. A couple of the other reportings that I did want to cover through, as I've mentioned, was around the HR side as well. Now, if we jump through to the HR space, what you will find is that you can actually view the HR area, which allows you to monitor the staff profiles for whether you have volunteers, whether you have staff or board members or the likes. And if we click on the HR system, what this gives you is a full HR profile for people to use within your agency. Now, first of all, just to run through this, people can actually update their general information, and I'll just log back in again for us as well too. So what you're able to look at, here we are here, is the individual staff profiles that people can actually see. And I'll just bring this up for you on the main dashboard. So the important part of this is that when we look at this, what we're needing to see is, from an HR point of view, is how do people update their contact information, keep up to date with their emergency details, or if there's existing things like working with children checks, police checks that they still may need to do as well too. If there's also other information and reports that you equally need to see, how do you in fact go ahead and do all that really quite simply for your agency to do? And how people actually do this is directly from the HR profile space. And as I've mentioned, what this really allows you to do is to monitor each of these specific sections for staff to actually view it. Now, let me just jump in and show you this here. So I've clicked on the My Info, and from here, people can update their personal details or their emergency contact details. And again, quite simply, they can simply click on Add, and what will come up is the details that they need to add in. And quite simply, everyone knows my details, so if I put in the details here, and I'll put brother-in-law to Fred Flintstone, and you can see that it automatically updates the profile here, and here we are. It's as simple as that. What it means then, that if you ever needed to run reports, whether that be across the individual working with children checks, police checks, also what people have actually used this for, most importantly, is for things like worker permits and assessments. So let's say I've actually got a worker's permit that I actually wanted to include in this. So quite simply, and this is actually a frequently used thing in Victoria at the moment around it, is the worker permits that people need to actually load in. So where can I actually register this information? Well, quite simply, I can go to personal details. I can click on choose file. I can take the worker permit that I want to have in and say, here is the state worker permit completed. And I can simply upload that document. And so what I've got is a copy of this document. I've got the date and the time that you can see here on the right-hand side that is being done. And I've got the file name and details that are also listed here as well. If I ever need to go back and have a look at this from a reporting point of view, then I've got this information here around it. So let's have a look at this purely from a work health and safety and fair work point of view. If I have this profile for Fred and I need to show to somebody, well, how has Fred actually met and demonstrated that Fred is actually aware of his COVIDSafe obligations? How can I actually show that to somebody, and what are the steps that I've done to keep Fred safe? I can now do this in 3 ways. Firstly, what I can do is actually go in and show them, well, firstly, I have my policy documents in the Gemma Docs area. Here they are here. I can show them the version of what we've loaded in from the work health and safety. I can look at the notice board item as well too and say, yep, here we are. Fred's read this on this date and at this time to acknowledge that he's done it. I can equally go into the COVIDSafe register of the COVIDSafe daily assessment forms and say, well, actually, each day Fred's actually completed this COVIDSafe form. Here are his details here. I'll just use this as an example. And if I just wanted to bring up Fred's information, I can then say, right, let me bring up and search for Fred or Prima. And here they are here. And I can actually show those, and I can actually have a look to say, yes, there have been no all the way through for all of these items. Equally, what I can also do is run a report around this and say, well, actually, apart from all of that, he's also got his worker permit that's listed here. Now, if I wanted to run a straight report around this, because this runs across working with children checks, police checks, DWES applications as well too, and registers, driver's licenses, all of that information you can actually keep in the qualifications and membership section as well. So if you wanted to, all that other info is there. If I wanted to run a straight report, let's say I needed this for the board, then I can quite simply go into this reporting part of the HR space, run a report, and I'll show you what this looks like. And I click on run, and here we are. I've literally got a straight report that I can export out across the entire COVIDSafe item. And here we are. I've just updated my emergency contact details, which is live here. There we are there. And I've also got my workers permit listed here as well too. So you can see directly from this report that I'm actually able to actually run all of this information directly out of here and across all of the agencies. Now, for people, and obviously there's a lot of agencies across Australia that are all working remotely at this point in time, and people jumping in at different times, it doesn't matter, because this will give you a single source of truth to be able to report around key requirements that you need to look at when you are going through it. So when we actually go back and actually have a look at things like what other agencies have done and how it's actually worked out for them and where they've actually gone to have a look at some of their reporting requirements. And if I just jump back to this as well too, what you can see from here is that we've got the pandemic plan, which is your overarching plan and reporting that you need to do. It covers off all of your COVIDSafe requirements from a legal compliance point of view. You've got your policies as well, which we've also set up as templates for you to use as well too. You can circulate it out to set up for staff and volunteers to effectively access the notice board and confirmation of what they've done and when. You've got your monitoring of your HR registers, which I've just taken you through, which gives you that full bird's eye view, plus also allows you to drop in licenses and other information that staff and volunteers need to manage as well too. And they can also manage that side of it as well. Now, the last thing that we wanted to just touch base on was around your risk reporting sides as well. Now, your risk and incident reporting is one of the important sides for yourselves to actually have a look at. And it is something that you go, my goodness, how do we actually report an incident that has actually happened? So it might be something that somebody actually has had a come into close contact with COVID-19, or they might have tripped and fallen, or there's an incident that's happened. Now, what we can do here is when I click on the risk management button, here is the forms that come out. Now, if they've come into close contact with another person with COVID-19, then they can use the hazard form, because it's a hazard that it's not something that's actually occurred as yet, but they possibly could have come in. So if we click on the hazard form, then what will come up is a list of questions that they need to complete around it. Okay. If, on the other hand, they say, no, we've actually had an incident that has occurred, I am testing positive for this, then it is a notification of incident. And here is one here. So if I click on this, and again, I click on add a new entry, I can go through and complete this form. Now, this form is being used right across the country by a whole range of agencies, from health and community services to religious groups, to theatres, to people that run convents and other social groups as well too. And with it, if I go through and simply complete this form around it, let's say I'm a co-located person, location of incident, and I'll just put Victoria, but you could be in your own site as well too. It'll ask you to complete the date that it's happened and the time that it's happened, and I'm just going to select 11 o'clock around this as well too, because it's only just happened recently. I can give a detailed description. So in this came into close contact with someone that was coughing and had COVID-19 symptoms. Okay, this is really something that can happen and has happened more recently with people as well. So it'll actually prompt you to answer these questions around it. Now, if I select that it's a high incident, and this could be any staff that actually complete this, then what happens is that it'll automatically inform you directly about this. And it'll come to you by email saying this is a high notification and it needs to be actioned around it. So we have, just for time's sake, completed a couple of other forms previously around this. And let me go back to those now. So I can have a look at these registers. And just to show you how this works. So I can actually go into here, look at this and see what has actually happened. You'll find that with this, there is options for uploading evidence or photos into it, because it is a mobile application as well too. So if I had this loading on my phone, I could take a photo of it, of where it occurred. If I needed to go in and see a doctor or have a test done, COVID-19 test, or go and see another GP around something else as well too, I could take a photo of that and load that in. And again, it will give me the date and time that's actually occurred as well. And by doing this, what it'll give me is all of the required activities. Now, from a legal point of view, I've then just said here, warning to friends over what they've done and how they actually do it. And all of my activities that I'm protecting the staff on and what we've done is then registered on this system for us to see. You'll find that at the top, if anyone turns around to me and says, well, hang on, when was this done? How quickly did you actually action any of these items? I've got audit logs at the top of this screen, and here we are here. These audit logs essentially tell me who's done what and when on the system. So if I have all my staff on here and volunteers, anytime that they lodge an incident, it's recorded. I can go back and have a look. As I've said, we've had situations where we've been doing this for over 10 years now. Some agencies have had to have auditors come through, work health and safety issues, legal issues that have arisen. And it's not something that's just kept for this week or tomorrow. It's something that's kept for years and years and years and years. As a legal firm and an IT vendor as well too around this, we are required to keep this information for 50 years on your behalf from the date of last use. And this date actually resets every time somebody logs into the system. So your information is actually kept very, very safe around this. And if you need to, or there's any issues coming back, you can access this at any point in time and actually see it. So you can see from here, what we've got is, from a monitoring side, what we have is a complete area for yourselves to manage all of your reporting requirements on. Looking at this, it covers off your COVIDSafe monitoring. It should be able to, and what we've covered off today was your COVIDSafe legal compliance plans. We've covered off how you can pull those quickly and get them out to departments of health around either your plan summaries, plus also your activities, plus also any documents that you've actually actioned, and print those off literally in under a minute. We've looked at policy requirements and reportings for you and how you can update those. We can look at, we've looked at the HR system and the registers around this. We've looked at the risk registers as well too. And you can see that completely by involving all of your staff across this, what you're able to do is essentially meet all of the Commonwealth specific reporting requirements for what employers should do to reduce the risk of COVID-19, and also what you need to do in terms of providing support to your staff. And it's something that is done very, very easily for agencies to do as well too. We have seen that quite simply this system works with agencies. We have seen this work, as I mentioned, for Rumbalara Aboriginal Cooperative. We've seen this work for Women's Housing Limited as well too. We've seen this work for migrant resource centres as well, for religious groups, for just about every type of not-for-profit agency across the country as well. The monitoring of this, once you roll this out to your broader staff, becomes a very, very effective way of managing any of your legal compliance risks for your agency and in terms of what you need to meet and when. With it, there is a series of recommendations that we are making to people as well too, and we will open it up very quickly for any question and answers, and we can see there's a few that have come through. So what we suggest you do is to actually look at loading your staff profiles across the GEMBA 360 COVID-19 COVIDSafe dashboard, reviewing the plan and the disaster plans, looking at the policies and the pandemic forms, and rolling out your monitoring. This will be the biggest part that you can actually get in terms of traction for your agency as well. You do have access to the COVIDSafe dashboard to commence working on this for one agency. Obviously, if you are listening to this is a recording and you don't have access to this, by all means, please contact us and we can open that up for you as well to access. We're happy to stay on the line and answer any questions that you might have. If you are watching this recording afterwards and you want to contact us, please do so by contacting us on 1300 360 360 or emailing us at support@gemba360.com.